Hi, good evening. Thanks for joining us. I'm Dwayne Brown. It is day one of a government shutdown. Congress wasn't able to make a deal to keep everything going, so thousands of federal workers are now furloughed and national parks and monuments are closed. In San Diego, furloughs for nearly 1,200 at Camp Pendleton and more than 300 each at MCRD and the Miramar Air Station. 1,500 workers will be furloughed from the Space and Naval Warfare Systems Command. 300 IRS workers are also without pay today. Cabrillo National Monument is closed, and so are campgrounds at Cleveland National Forest. Local military commissaries also shutting down. The latest on the congressional standoff from Jerry Bodlander of the Associated Press.
As barriers went up around federal monuments and landmarks because of the partial government shutdown, congressional Democrats and Republicans were blaming each other.
Speaker Boehner and his band of Tea Party radicals have done the unthinkable. They've shut down the federal government. Now, for us, that's hard to comprehend as being good. For them, they like it.
Senate Democrats rejected House Republicans' offer to come to the negotiating table.
My goodness, they won't even sit down and have a discussion about this.
The stalemate revolves around House Republicans' insistence that changes be made to the health care law. Senate Democrats and the president say that's a non-starter.
They've shut down the government over an ideological crusade to deny affordable health insurance to millions of Americans.
The president says the hundreds of thousands of furloughed federal workers caught in the middle are punching bags. And while both sides say they want a quick end to the shutdown, there's no indication yet of any compromise. Though Republicans on both sides of the Capitol are talking about pushing small funding bills so parks can be reopened and veterans' claims can be processed quickly. Jerry Bodlander, Associated Press, Capitol Hill.
San Diego's congressional delegates are split on who to blame for the government shutdown. Democrat Juan Vargas told UT San Diego he is, quote, extremely disappointed that Speaker Boehner and House Republicans continuously blocked a vote, end quote. While Republican Darrell Issa told the paper, quote, it's irresponsible for the president to refuse to negotiate with Republicans. He says because of his stubbornness, Americans are suffering, end quote. And Democrat Scott Peters says there's a leadership failure of the Republican majority. He says he'll donate his pay to charity during the shutdown. The government shutdown didn't stop Californians from trying to sign up for new health care coverage as 6,500 people flooded call centers within 90 minutes and covered California's website as well. Now, that's the online marketplace to shop for health insurance. Like a wave crashing on the shores of Ocean Beach in San Diego, Covered California is officially open for business, where 1 in 4 people in the state have no access to health insurance. Dr. Robert Ross is with the California Endowment and a board member of Covered California.
If you have health insurance, you're fine. If you have Medicare, you're fine. Obamacare doesn't affect you. If you're uninsured, come to our website and check us out, comparison shop, and buy an affordable product that works for your family.
Ross says the goal is to register 2 million of the 5 million uninsured people in the state, no matter what the politicians in Washington are trying to do to stop it.
We're going to behave as if Washington is doing their own thing. We're going to do our thing and make Obamacare work, the Affordable Care Act work for Californians, and that's the best thing that we can be held accountable for.
Online enrollment has already been flooded, and you may run into some delays, but Ross says be patient. Sharp Health, based in San Diego, is one of 6 plans offered under Covered California. Melissa Hayden Cook is the hospital CEO.
In addition, there are over 180,000 San Diegans that may be eligible for subsidies, and this gives these San Diegans a chance to access affordable health care.
Enrollment at coveredcalifornia.com is now open, with coverage beginning on January 1st. The opening of healthcare exchanges throughout the country marks the biggest change in healthcare since Medicare was established nearly 50 years ago. For a look at some of the options available to San Diegans, we go to Amitha Sharma, who's in for Peggy Pico tonight.
Enrollment in Obamacare starts today and goes through the end of March, with insurance benefits kicking in as early as January 2014. Here with details on signing up as a family or individual are Gary Rotto with the Council of Community Clinics San Diego and Jeanette Shea with Family Health Centers of San Diego. Welcome to the program, both of you.
Thanks, Anita.
Gary, Covered California is the name of the insurance exchange. How many people in San Diego County are uninsured?
There are about 500,000, a little over 500,000 individuals that are currently uninsured. And we believe there'll be about 190 to 200,000 that will be eligible to be in the exchange and receive a subsidy for their health coverage.
And how much will the average individual, average person or family pay in insurance premiums?
It's going to depend upon their age and the number of dependents, size of the family, and where they live. I heard one figure that a family of 4 would be about $370, $375 a month would be their coverage. It's really going to depend upon an individual situation.
And Jeanette, what are some of the insurance options that people have?
Sure. So under Covered California, there are 6 plans in San Diego County, and they've got names that are going to be familiar to many San Diegans, like Kaiser, Sharp Health Plan, HealthNet, Molina, and Blue Cross. And within those plans, there are several different levels you can choose: gold, silver, and bronze. And those just vary how much you're going to pay for your premium versus how much you would pay for co-pays and out-of-pocket costs.
And what do the plans actually cover?
So the plans cover basic medical care. So it would be your coverage with your physician, with your prescriptions, going to the hospital. There are additional supplements you can purchase for dental and vision care as well.
And what about out-of-pocket expenses?
They are really going to vary by plan. So what we want to do is encourage everyone to go to coveredcalifornia.com and look specifically at each plan, what the limits are, how much you pay. And again, it's going to vary whether you pick the bronze, silver, or gold level and the specific plan you choose.
And Gary, how can people begin to start narrowing down their options?
Well, the first thing is, do you have a provider that you currently see? Do you like that provider? Well, you'll be able to go on the website, take a look at the plans that are offered in San Diego, and then be able to see if your provider is part of their network. And then the other thing to do is figure out, what do you spend, where do you spend your health care dollars? Do you have a lot of prescriptions? Do you have a lot of office visits for your kids? Figure out how much that is, and then take a look at the deductible for each of the plans, gold, silver, and bronze. See what makes sense for you, how much your deductible would be, how much your premium would be based upon those deductibles.
So people have between now and March 31st to sign up or pay a fine. What does that fine look like?
The fine in the first year is $95 or 1% of your gross income. In future years, that'll go up significantly.
And what's your sense of how informed people are about this program?
They're becoming more informed. They're just hearing about it, and now they're going to start to go to do some window shopping, so to speak. They're going to go to the website, they're going to see the number of plans that Jeanette described and who they are, and start to see, does it make sense for me, and which plan would make sense best for me and for my family.
And what can people do to inform themselves even more? I know you mentioned a website. Are there other options out there?
Absolutely. So they can call us at Family Health Centers. The number is 619-515-2363. They can also call 211 here in San Diego. They can go to the coveredcalifornia.com website, and they can also call coveredcalifornia.com. So the message we want to make sure everyone understands is there are many of us here in the community that are here to help, here to meet with you one-on-one to figure out what you're eligible for, help you enroll, help you complete the application. You just have to ask.
I know that the Obama administration is starting an education plan on this program in the next several months. What do you think is key in terms of reaching people and helping them understand?
Well, the first thing is to let them know that this marketplace, you can think of it as like the Amazon marketplace, where you can purchase, you can even just do the window shopping, you can be looking and see what products are there, what are the health plans that are participating in San Diego, and start to do a little looking. Click around, see what works best for you as far as the plans that are offered and what your family's needs are.
And do you expect a lot of window shopping to take place?
Absolutely. We hope that people will start with window shopping. And if you're ready to purchase, go right ahead, whether you call one of the clinics, Council Community Clinics, Family Health Centers, 211, or Covered California. Allow us to help you in that, in making that decision and guiding you what to be looking at as you pick the best plan for your family.
Gary, Jeanette, thanks for coming on the program today.
Thanks for having us.
Thank you.
Latinos make up nearly half of the 5 million uninsured Californians who are eligible to apply for health insurance under Covered California. But there's still some confusion in the community about what they qualify for and how to get it. Activists say getting the right information out has been a challenge.
The people sometimes they're a little scared about it, that they don't think that they could qualify because they don't understand it's still the Obamacare or the Affordable Care Act.
Information is available online in 13 languages, but there has been a delay in Spanish language signups. People still have plenty of questions about the Affordable Care Act or Obamacare. We are taking your questions online at kpbs.org/second opinion. Amitha Sharma continues our coverage of today's rollout of Obamacare with a closer look at the options for local businesses.
Small businesses with fewer than 50 employees are not required to provide medical insurance, but it's a different story for large companies. Here with more on how this could affect local employers are Kamal Mullenberg with San Diegans for Healthcare Coverage and health insurance broker David White. Welcome to the program.
Thank you very much.
David, how does the state's health exchange, Covered California, serve small businesses?
Well, it's a marketplace to give them a different opportunity to be able to buy insurance. They can buy insurance through the exchange or they can buy it through a broker. You want to buy it through the exchange if you can get a tax credit. There are tax credits starting next year is up to 50% if you buy through the exchange. So that's really a benefit for small businesses. However, you also have to have a average salary level of less than $50,000 if you have 25 or less employees. So there really is a lot of advantages for small businesses, and also really health insurance is a benefit. It's an employee benefit, and competitive companies want to give that to their employees.
So are the plans offered to small businesses similar to those offered to individuals?
We think that they're going to be in the future. It's kind of difficult right now to find out if they're the same. Those of us that have been in the business for a long period of time know that they're not the same as of, let's say 2013, first part of 2013. But we think that they're going to change, and eventually they will become more and more and more similar.
And Kamal, let's bring you into this conversation. As we know, small businesses with 50 employees or under are not required to provide health insurance. He talked about some of the advantages of doing that. What's in it for them to offer health insurance?
Well, I think the biggest one is for the very small businesses under 25 employees. The tax credit can be a very significant help in terms of paying for the premiums for employees. And my sense is most businesses would like to offer coverage if they can. So having some new options available to them through the exchange with the tax credit may encourage some businesses that don't offer today to offer to their employees. And the other side is that I think it's really important that small businesses understand it's a choice. There's no penalties if they don't offer coverage, but there are incentives if they do.
So let's switch to larger employers. Those with 50 full-time employees or more are required to provide health insurance. When does that mandate kick in?
It really kicks in 2015. There's been a delay in that because there were a lot of rules regarding reporting requirements for businesses, as well as a lot of pushback on the original regulation, which defined what the penalty would be and what the mandate would be. It's not really a mandate, it's more you either play or pay. I hold out hope that they're going to improve the rules, so I don't even think it's worth talking about what they're going to be because we really don't know.
And what happens if these businesses do not comply?
For this first year, nothing. But starting in 2015, there will certainly be penalties associated with not offering adequate coverage to their employees or not offering at all. But what that looks like, we don't know.
And David, what are you hearing from businesses in San Diego in regards to this?
Well, it's very, very interesting because the ones under 50, since they don't have to do it, they're a little bit confused just because they're not sure exactly what they have to do, even though there's a lot of reporting to do. The ones over 50, again, are also confused. Because one of the things that happens is if you get a company, let's say, of less than, 150, 200 people, you don't really have a big HR department that can be on top of all these things and be aware of all the things that need to be done and have people on staff that can spend all the time learning all about it. So it's really that, let's say, small to more medium-sized company that's really in kind of like in a tough time right now because they don't know exactly what to do. They really need to talk with their accountants and their attorneys and their CPAs and other people like that, as well as their broker, to find out specifically the kinds of things they have to report.
And very quickly, how do you think the Affordable Care Act will change how businesses do business?
I don't think it's going to change all that much, because I think the majority of businesses right now are going to keep their plans. They're not going to change them. It will change the businesses with a lot of 10 to 12-hour employees. In other words, 10 to $12 an hour employees. For example, like a McDonald's restaurant. Many of them are owned by one man or woman, might own 5 or 6 of them. And so then they're going to have more than 50 employees, and they're going to have to provide health insurance. It's going to be very, very difficult for them. One of the things that I see coming around is what you call a defined benefit, where you can sit there and say, I will pay X amount of dollars for your health insurance. As a company, we'll do that to you. Then that helps them to be able to buy it on their own on the exchange.
And we need to wrap it there. David Kummel, thanks for coming on the program today.
Thank you very much.
San Diego utility customers are getting their say tonight about whether they should have to pay for the closed San Onofre nuclear plant. Federal regulators are holding public hearings to determine if ratepayers will get a refund or a rate reduction. The plant's operator, Southern California Edison, says customers should not receive a discount. Venture capitalists are cutting back their funding for clean tech industries in the state. KPBS business and environment reporter Eric Anderson is in the news center to explain what it all means. Eric, clean tech is a relatively new industry here in California. What did the report find out about the past 10 years?
Well, Dwayne, the study followed the money in the clean technology industry. Clean tech is considered any product, service, or technology that focuses on softening the environmental footprint of a product, a service, or a technology. Now, that includes things like solar systems, for example, or electric cars, or devices that require less energy for similar or better performance. Now, the nonpartisan group Next 10 wanted to find out who's paying for the clean tech research. 10 years ago, nearly 70% of the research funding came from venture capital firms. They're companies looking to invest in emerging technologies. Venture capital with corporate funding made up about 27% of the funding pie, and that ratio has changed as venture capital funding has fallen. It fell to 33% of the funding pie last year, while venture capital with corporate support swelled to about 42% of all clean tech financing.
And Eric, what is this telling us about clean tech?
Well, the Next 10 study says that the shift to more corporate involvement in the investment pie could point to a maturing economic sector. The report suggests that corporations may be more likely to get involved in funding a clean tech company or product if the firm is close to bringing that product or service to market. Noel Perry of Next 10 told me that clean tech has developed significantly over the last 10 years, and he says this may be the indication that the sector is no longer emerging technology, but more mainstream technology.
KPBS business and environment reporter Eric Anderson. Governor Brown last week ordered a statewide earthquake early warning system. The goal is to alert Californians before powerful seismic waves hit. KPBS reporter Susan Murphy talked to some San Diego researchers who helped develop the technology behind the warnings.
Under the new statewide earthquake alert system, San Diegans could be warned approximately 20 seconds before the shaking begins from a large earthquake on the southern San Andreas Fault. On the much closer San Jacinto Fault, an early warning could mean just 5 to 10 seconds, but enough time for people to take cover and to save lives. The early warning technology was designed with the help of Scripps Institution of Oceanography researchers Frank Vernon and Yehuda Bach, who have worked for decades on earthquake sensors.
We stream data in from multiple field stations along the San Jacinto Fault Zone, which was specifically mentioned in this bill.
Research seismologist Frank Vernon has set up a network of 30 seismology sensors around Southern California. The instruments can detect initial seismic waves after a fault ruptures and assess the strength and direction of secondary waves before the shaking begins.
Seismology tends to measure dynamic motion, as Yehuda said, so it measures how fast things shake and how much what the accelerations are.
Vernon says seismic sensors alerted millions of people in Japan up to a minute before the massive earthquake reached them. But the sensors failed to rapidly determine the quake's magnitude. That's where a second piece of technology comes in. Scripps researchers have placed hundreds of GPS sensors throughout Southern California. These high-tech instruments measure ground displacement and can quickly determine a quake's magnitude. The researchers are working to combine the GPS and seismic sensors to provide a more complete description of what occurs during an earthquake. They hope this model will be used for California's early earthquake warning system, but they say training the public on how to respond with just a few seconds of warning could be more complex than the technology. Susan Murphy, KPBS News.
A San Diego ordinance has made it easier for community groups to access land to plant their vegetables, but water remains a sticking point. Speak City Heights reporter Megan Burks has the story.
At a small community garden on the corner of Ridgeview Drive and Fairmont Avenue in City Heights, there are a few plots filled with the straggling vegetables of the end of summer. There are tomatoes, pole beans, and squash, but the lot is noticeably bare. Out of the 19 garden beds, only 6 have anything growing in them. That's because gardeners at the Ridgeview Community Garden don't have access to water on their land.
Well, I want to do something that's growing. Can you get over it? I'll just put someone here. What the heck?
Instead of using a hose, they've been hauling water from their homes in gallon jugs and old laundry detergent containers. For almost 2 years, they've tried to work with the city to get affordable access to water. Garden organizer Jeanette Neely says it's a heavy burden for many of the senior gardeners.
If you can see some of the beds behind me, those are beds of 60 and 70-year-old people, and they paid for the beds and they filled them, but without water, they just don't have the wherewithal to do that amount of heavy lifting. We do lift and carry some water here in barrels, but it's a chore. It's a chore anytime you have to carry water. Water is 8 pounds per gallon if you've ever backpacked the Sierras. So I can tell you that it's a challenge.
San Diego amended its ordinance on urban agriculture last year, lifting restrictions on backyard bees, chickens, and goats. It also made it easier to establish community gardens. At least that was the goal. Community garden advocates say there are still roadblocks. Chief among them is the high cost of water. The Ridgeview lot once had a water meter hookup that served former residents, but it was cut off and covered up when the lot was made smaller to widen a road. Neely says the city quoted the gardeners $11,000 to reestablish the meter, and it nixed their plan to tap into a meter for city landscaping because there's no system for billing residents.
We keep getting shuffled from department to department. No one wants to take ownership and create a process where we're allowed to give them money. I know it sounds odd, but they don't have a billing system set in place that they could turn it on. It's not even on. If we could have that turned on, if we could pay the bill, we would be ecstatic. That's our goal.
In New York City, most community gardens get water from hookups to fire hydrants. Baltimore has issued a $100 fee for installing water meters in community gardens, and San Francisco has a grant program that cuts the cost significantly. In San Diego, community gardens are treated no differently than any other customer. An employee in the city's public utilities department confirmed installing a meter can run in the thousands of dollars. It's a bill most community groups can't foot. Judy Jacoby is the director and CEO of the San Diego Community Garden Network. She says that in comparison to other cities, San Diego still has a lot of work to do to support community gardens. She says a first step would be putting a single city department in charge of all community garden queries.
There is no one, actually, who feels it's their job to do to help people out. There is no liaison for community gardens. You can go to your council member and ask for help. They can be helpful, but it's just a matter of whether they choose to or not.
Jacoby says Seattle community gardens are overseen by a staff of 6 in the city's Department of Neighborhoods. Many other cities manage community gardens through their park and recreation departments. Jacoby says that the process in San Diego is so complicated that even she doesn't understand all of the nuances of establishing gardens on city-owned land. A spokesman for the city could not find someone to speak with KPBS at press time.
Knowing what department to go to and who to talk to with your list of questions really would make it a lot easier. The code in and of itself is not everything. The water department, how you get access to water, is there is no clear pathway to that. I don't know the clear pathway to it either.
Jacoby says her organization has been working with multiple community groups who want to start gardens. For some, several years have passed without any real headway. She says while San Diego has come a long way, the city could be doing more to support the self-sufficiency of its residents.
It all comes back to the question, if the city of San Diego values community gardens and thinks that that urban agriculture has a place in the city, and that that people who live in apartments should have a place where they can grow food or anything, then they should. They can. It's up to them to find a way to support it. Because
after working with representatives from multiple city departments over the past 2 years, the Ridgeview gardeners think they may have caught a break. They've been meeting with a customer advocate from Public Utilities who suggests a possible solution to the high water meter cost is working on getting certain fees waived for the group. While the gardeners say they want the city to make it more affordable for gardens to pay for water, Neely says they don't want a handout.
The next step to me would be to streamline the process in getting access to just landscape water. Help us to help ourselves, not give us anything free. We don't want necessarily free. What we want is allow us to get access to water, grow our own vegetables, share with our neighbors.
Megan Burks, KPBS News.
You can find tonight's stories online at kpbs.org/evening edition. Thanks for joining us. Good night.